चलिए अच्छा जी सो अस्सलाम वालेकुम एंड लेकिन अब the heat is going to increase as time passes. अब मैंने 2 मिनट पहले इसलिए आपको किया है so that if you have any questions so please do let me know. I'm here to answer your questions before I formally start with the lecture. आज भी हम इंशाल्लाह gross anatomy पढ़ के and we'll finish off with the syllabus of this first substage. The first substage is on Tuesday. So, do you have any questions regarding what I've taught you? कोई सवाल नहीं? All is well at your end? Sure, if that is the case, तो फिर मेरे ख्याल में हम क्लास शुरू करते हैं because now it's exactly 10 o'clock and we still have half of you who are still sleeping. तो ठीक है, रोजे के साथ सुबह उठना is a problem लेकिन अब तो 10 बज गए हैं so I think it's time you guys got up. अच्छा जी हमने temporomandibular joint हमने शुरू कर दिया था and we said कि it was a modified type of a hinge joint. Synovial joint की variety है modified hinge joint. This is the temporomandibular joint. It is formed between this is the mandibular fossa. The mandibular fossa is lying in the temporal bone. This in orange thing is the temporal bone. This side. ठीक है? Even this diaphragmatic arch, this part is formed by the temporal bone. So this mandibular fossa in the temporal bone and mandible, the head of the mandible and the mandibular fossa in the temporal bone. They contribute to the formation of temporomandibular joint. In every joint, the articulating surfaces, these surfaces, the head of the mandible and the undersurface of the mandibular fossa. I'm talking about these two articulating surfaces. Normally, have a joint when these articulating surfaces are covered with hyaline cartilage, articular cartilage, which is a variety of hyaline cartilage. Okay? That is what normally happens in every joint. Aap knee joint le le, elbow joint le le, whatever. But over here in this case, बेटा ये जो articulating surfaces है ना, they are covered with fibrocartilage. Mandibular fossa भी and head of the mandible. They are covered with fibrocartilage, not hyaline. ठीक है? Temporomandibular joint में joint surfaces are covered with fibrocartilage. That is why we call it an atypical type of a joint. Because unlike all the joints that are covered with hyaline cartilage, यहाँ पे fibrocartilage है. Now, besides that, the joint contains a fibrocartilaginous disc. ये जो है, this is the disc lying inside the joint cavity. ठीक है? Like all joints, this joint is also covered by a capsule. This capsule is loose, tightly fitting. नहीं है, it is loose. It is attached to the articular margins. Articular cartilage के साथ attached है at the mandibular fossa. Temporal bone की जो mandibular fossa है, उसकी articular cartilage जो है, उसको लाइन करती है, उसके साथ attached है, and At the lower end, it is attached to the neck of the mandible. ये देख लीजिए, ये head of the mandible है, इसको condyle भी कहते हैं, condyle of mandible. This is the neck of the mandible. The capsule is attached to the neck of the mandible and to the articulating surfaces of the mandibular fossa. अच्छा, before I go any further, बेटा आपको let me go back for a minute. अच्छा, ये देखो, ये this is the articular tubercle जो कि mandibular fossa को deepen कर रही है. The mandibular fossa and anterior to the mandibular fossa, this is the tubercle, articular tubercle. ठीक है बेटा? Okay, let's carry on with our temporomandibular joint. TMJ stands for temporomandibular joint. This is an internationally recognized abbreviation, and we have to remember it because कहीं पे भी आपको जितना लंबा temporomandibular joint लिखा हुआ नजर नहीं आएगा, it would always be TMJ. अच्छा जी, so हम articular capsule attach कर दी. Now I hope you appreciate ये जो articular disc है ना, this is on the inside of the capsule. As a result, it's going to be attached to the margins of the capsule. Either be capsule on the inside of the margin, this disc is attached, and over here as well. यहाँ पे ये देख लीजिए, this is the joint cavity. This is the mandibular fossa, the inner surface, under surface of the mandibular fossa. This is the head of the mandible. ठीक है? This is the ramus of the mandible. ये mandibular notch है. अच्छा, so ये जो whitish structure, this is articular disc. Please note, ये capsule है बेटा. This is the capsule of the TMJ. Posteriorly, this is the capsule of TMJ. Beta, this is the external auditory meatus, external acoustic meatus. You have the air on top. इस drawing में the air has been removed. कान पिन्ना जो है that has been removed. So this is the opening. So that is how you know that this is the posterior end. और anteriorly articular tubercle होता है, and then also you have the mandibular notch. ये articular tubercle है, ठीक है? अच्छा, ये वाला पार्ट देख लीजिए, head of the mandible, ये articular tubercle है, this is the mandibular notch. अच्छा, जिसमें हम आगे चले, so this articular disc is attached to the inside of the capsule posteriorly, to the inside of the capsule anteriorly. So disc is attached to the inside of the capsule. ठीक है? As a result, because of the presence of this disc, the entire joint cavity is divided into two compartments. There's one compartment between the under surface of the temporal fossa and the upper surface of the disc. ये जो yellow है, this is a superior compartment of the TMJ. अब ये head, ये उसकी articular cartilage. ठीक है? So you have another compartment above the articular cartilage of the mandibular condyle and the under surface of the articular disc. This gap between the articular cartilage, the under surface, and the upper surface of the head of the mandible. इन दोनों के दरमियान, इन दोनों surfaces के दरमियान ये जो gap है, this is the inferior compartment. So दो compartments हो गए, एक superior compartment हो गया, this one, और एक inferior compartment हो गया, this one. ठीक है जी? And both these compartments are lined by synovial membranes. ठीक है? Separate synovial membranes, इसलिए ये separate compartments है. अच्छा जी, प्लीज एक बात याद रख लीजिए, ये जो आपका temporomandibular joint है, this is very very important. ठीक है? Examination point of view से भी क्वेश्चन इसमें जरूर आता है। सो इसको आप देख लीजिए, आपके प्रैक्टिकल पॉइंट ऑफ व्यू से ये बहुत इंपॉर्टेंट है। इसके लिगामेंट्स पे आ जाते हैं। इसके there are two types of ligaments, extrinsic ligaments होते हैं और intrinsic ligaments होते हैं। Intrinsic ligaments are simply thickenings of the capsule. They are called lateral ligaments. ये देख लीजिए, ठीक है, ये this is the temporomandibular joint, this is the lateral, ये capsule of the joint है ना, ये lateral ligament. Lateral ligament is simply a thickening of the joint capsule that forms the lateral ligament. लेकिन it is this lateral ligament that prevents the joint from dislocating posteriorly. एक ये ligament plus यहाँ posterior tubercle, ठीक है, over here you have a posterior tubercle here. These two factors prevent, sorry, the joint from dislocating posteriorly. ठीक है, दूसरे एक्सट्रिंसिक लिगामेंट्स हैं, ये स्टाइलोमैंडिबुलर, ये स्टाइलर प्रोसेस है ना बेटे, this is the styloid process, this is the angle of the mandible. So this ligament extends from the styloid process to the angle of the mandible. यहाँ पे देख लीजिए, this is the styloid process, this is the angle of the mandible. So this is the stylomandibular, ये stylomandibular ligament. This is simply a thickening of the posterior part of the capsule of parotid gland. So capsule of the parotid gland की जो posterior layer है, that thickens to form this ligament. And then is the sphenomandibular ligament. Spheno is sphenoid, spine of the sphenoid. ये दिखा देती हूँ आपको यहाँ पे, ये जी, this is the spine of the sphenoid and this is the sphenomandibular ligament. ये बेटा this is, अब ये light इसलिए है because this ligament is on the inside, attached to the inside of the mandible. If you remember correctly, on the inside of the mandible, there was this opening, mandibular groove जो होता है, ठीक है, mandibular canal. यहाँ पे you have the mandibular canal running through the body of the mandible. This canal is guarded by ये जो chip of bone होती है, this guards, चौकीदारा कर रहा होता है इस mandibular जो opening है, mandibular canal की opening, इसके ऊपर ये एक chip of bone लगी हुई है, इसको lingula कहते हैं. So this ligament is attached to the spine of the sphenoid over here. Sphenoid bone की एक spine है, उस पे attached है, and then on the inside of the mandible, it is attached to the lingula. This provides a primary support for the joint. ये जो ligament है ना, sphenomandibular ligament, it provides us primary support for the joint. Nerve supply, please, बहुत important है इसकी nerve supply. The nerve supply comes from auriculotemporal nerve and the mesenteric nerves. बेटा ये दोनों उसको सप्लाई करती हैं. आपकी किताब के टेक्स्ट में सिर्फ auriculotemporal nerve लिखी हुई है, लेकिन this drawing is taken from KLM और उस KLM में इसने बनाई हुई है mesenteric nerve. And please note, the mesenteric nerve also gives branches to the joint, meaning it is giving articular branches. Auriculotemporal nerve भी articular branches दे रही है, ठीक है. Grace भी ये mention करता है, Last भी ये mention करता है, your book also mentions, but it does not write this fact down in the text. Mesenteric nerve से मुराद है nerves, the nerve that supplies the masseter muscle, ठीक है, that is mesenteric nerve. अच्छा जी, movements पे आ जाते हैं. So I told you, okay, fine. There are two types of movement. Temporomandibular joint में there are two types of movements. एक ग्लाइडिंग मूवमेंट है और दूसरा जो है ना वो हिंज मूवमेंट्स है. ग्लाइडिंग मूवमेंट्स बेटा दे आर protrusion, forward movement of the mandible, and retrusion, backward movement of it. You move your chin forward, that is protrusion, and when you bring it back to its normal position, वो protrusion होती है. ये जो movement है, this occurs in the upper compartment. ये articular disc है बेटा, ठीक है? This is the capsule. The articular disc is attached to the inside of the capsule. ये lateral pterygoid muscle है, attached to the neck of the mandible. ये condyle of the mandible है. This is the neck of the mandible. So the movement of protrusion and retrusion takes place in this compartment, the compartment which is between the temporal fossa and the upper surface of the disc. ये superior compartment है. So the gliding movement of protrusion and retrusion takes place at this particular compartment. Now comes the hinge movement. Hinge movement, beta, is the movement of elevation and depression. When you open your mouth so that your jaw is hanging down, that is depression. And when you close your mouth from this open position, that is elevation. बेटा जब मुंह खोलते हैं तो mandible moves down, it is depressed. ठीक है? और जब मुंह बंद करते हैं that is elevation. ये जो है ना plus rotation of mandible. Both these movements take place in this compartment, the inferior compartment, the compartment which is between the undersurface of the articular disc and the upper surface of the condyle. इस compartment में, inferior compartment में, the movement is elevation and depression plus rotation. अभी इसको discuss कर लेते हैं. अच्छा जब at rest what happens? ये position है. This is the articular tubercle. This is the head of the mandible, the blue one, और ये on top. This is the mandibular fossa. Okay. So, अब normal position में, when the mouth is closed, resting phase में, ये जो head of the mandible है ना, this is fitted into the mandibular fossa. ठीक है? अब ये fit इस तरह से आता है कि ये mandible to some extent is retracted, it is moved, pushed back, या pulled, it is pulled back. ठीक है? Pulling back of the mandible is retraction. Chin elevated होती है, and this position is maintained by the tone of the muscle. The tone of the retractors and elevators of the mandible, they maintain this normal position, which is the head fitted into the mandibular fossa, the mandible retracted. ये normal position है at rest. When we are just sitting, not talking to anybody, not eating, not knowing, nothing. ठीक है? अच्छा. However, now what happens? When you go off to sleep, deep sleep, गहरी नींद सो रहे हैं. In that case, ये जो muscle tone है ना, ये जो elevators और retractors की जो muscle tone है, ये भी relax कर जाती है. When the muscle tone relaxes, the jaw drops down. ये देख लीजिए. इसलिए शायद आपने नोट किया होगा कि when people go off to sleep, गहरी नींद में होते हैं तो उनका मुंह खुला हुआ होता है. इतनी गहरी नींद होती है कि उनका मुंह खुला हुआ होता है. वो मुंह इसलिए खुला हुआ होता है because the muscles that close the mouth, that means the elevators and the retractors. ये जो muscle है that close the mouth, अब इनमें टोन जो है खत्म हो गई because muscles are relaxed now. ठीक है. प्लस दूसरा इफेक्ट ग्रेविटी का भी तो है ना. When the muscles are relaxed, they are not acting. The gravity affects the mandible, and the mandible drops down. Actually, opening of the mouth. ये सारी drawings आपके KLM की है. बहुत अच्छी drawings हैं. All you have to do is just look at them carefully and then study them. Now, what happens when we open the mouth? When we open the mouth, अच्छा, पहले तो normal position में देख लीजिए. ये articular to the thing. This is the head of the mandible. ये mandibular fossa है बच्चे, and this is the disc. Posteriorly be attached to the inside of the capsule, anteriorly also. ठीक है? अच्छा. Now, this is a normal situation. When you open the mouth, this is what happens. The head of the mandible leaves the mandibular fossa, moves forward, and comes to lie under the articular tubercle. Up the head, it does not move alone. The head plus disc, articular disc, both together, they move anteriorly, come out of the fossa, move anteriorly, and come to lie under the articular tubercle. अगर तो ये सिंपल मूवमेंट है with the mouth भी, और इसमें depression of the mandible is not involved. ठीक है. ये closed position है mandible with the mouth closed. ये देख लीजिए. The condyles of the mandible are fitted well in the mandibular fossa. ये mandibular fossa है ना, ये articular disc है. So the condyle is fitted well, दोनों sides. However, this is what happens when the chin protrudes. That means it moves forward. The head of the mandible comes to lie under the articular tubercle. Head plus articular disc. They both move together and come to lie under the articular tubercle है, ये mandibular fossa. So chin की जो movement है वो forwards anteriorly है. अब इसमें depression of the mandible is not involved. उसका रिजल्ट ही है that the mandible will just protrude forward. जिस तरह आप chin करके बाहर निकालते हैं, मुंह बंद करके. ठीक है. यहाँ पे ये normal position है, mandibular fossa, tubercle, ये head or neck of the mandible, and when you open the mouth, this is what happens. The head and neck of the mandible come to lie under the articular tubercle. अब यहाँ पे जो चीज नहीं नजर आ रही वो articular disc है. Articular disc also moves with the head. अब क्या होता है? When you open the mouth, wide opening the mouth, उस सूरत में the head of the mandible that moves comes to lie under the articular tubercle. ठीक है. But it also involves the depression of the mandible. ये जो mandible है अभी horizontal position में है when the chin was protruding. But when you open the mouth, wide opening of the mouth, it happens when you are eating, put a morsel in your mouth, मुंह में निवाला डाल देना, खोलते हैं. ठीक है. In that case, the chin moves down like this. Okay, so position वही है कि the head of the mandible is lying along with the disc is lying under the articular tubercle. सो एक ये पोजीशन है जिसमें डिप्रेशन ऑफ द मैंडिबल इन्वॉल्व नहीं है, इसमें सिंपल मैंडिबल की प्रोट्रूजन है, और दूसरे सूरत में डिप्रेशन ऑफ द मैंडिबल इन्वॉल्व है, दैट इज वाइड ओपनिंग ऑफ द माउथ. नाउ व्हाट हैपेंस? अब देयर इज अनदर सिचुएशन. ये नॉर्मल है, माउथ क्लोज एट रेस्ट पोजीशन ये दिखाई दी. नाउ देयर इज अनदर सिचुएशन व्हाइल यू आर च्यूइंग, चबाते हैं जब. In that case, the head and the articular disc of one side is protruded, and the head and the articular disc of the other side is retracted. एक side की head of the mandible anteriorly move करेगा, दूसरी side का opposite side का posteriorly move करेगा. इस सूरत में भी the head, I'm so sorry, the head is rotated. अब ये सिर्फ तब possible होगा when the head rotates. This is rotation. थोड़ा सा head rotate करेगा तो it will allow the opposite side to move back. ठीक है? So this is what happens. अब ये आपकी chewing movements होती है. This is the opposite side. ये एक दफा इस साइड पे, दूसरी दफा इस पे रोटेशन होगी, and the chin will move forwards. And finally, the movements of the temporomandibular joint and the muscles that produce this movement. I think I've taken far too much time over it. Elevation, the closing of the mouth, is produced by temporalis major medial pterygoid. Depression, that is opening of the mouth, that is produced by the lateral pterygoid, the suprahyoid, and the infrahyoid muscles. Then is protrusion, when you push the mandible forwards. Protrusion is produced by lateral pterygoid and the medial pterygoid, and retrusion, that is pulling the chin back into normal position, that is by temporalis posterior fibers, horizontal fibers जो होते हैं, and oblique fibers plus the masseter. Lateral movements जो होती हैं, grinding and chewing की movements, उसमें temporalis of the same side and pterygoids of the opposite side plus the masseter. ये आपकी बुक में से टेबल मैंने उसी तरह ही कॉपी पेस्ट की है. You have to remember it as such. Okay, now ये बहुत important है बेटा, very important. Please, अगर आपको एक normal anatomy समझ में आ गई है, तो this should be no problem. देखो अब एक सूरत है कि wide opening of the mouth, जमाई लेते हुए yawn कर रहे हैं, excessive opening of the mouth, या for some reason excessive contraction of the lateral pterygoid. ठीक है? इन दोनों सूरतों में the head of the mandible dislocates. जब वो dislocate कर जाता है, देखो normally opening of the mouth पे हमने कहा था the head of the mandible comes to lie under the articular tubercle, यहाँ पे होना चाहिए. But when there is excessive opening of the mouth, wide opening of the mouth, yeah, excessive contraction of lateral pterygoid, please, lateral pterygoid only. तो फिर ये जो head of the mandible है comes to lie in front of the articular tubercle. ये articular tubercle है, the head of the mandible is lying in front of the articular tubercle. इसको anterior dislocation कहते हैं. So excessive contraction of the lateral pterygoid produces anterior dislocation of the head of the mandible. अब इस सूरत में what will happen is the mandible is depressed. सिर्फ उसी सूरत में ये head comes to lie in front of the articular tubercle. That is when the mandible is depressed. अब यहाँ पे ये जाके fix हो जाता है and the mouth remains open. ठीक है? ये उस सूरत में भी है, एक मुक्का मारा और वन साइड ऑफ द फेस साइडवेज ब्लो, उसमें भी चेन डिस्लोकेट हो जाती है। जिस साइड पे मुक्का लगा उस साइड पे द मैंडिबल डिस्लोकेट्स एंड द माउथ ओपन्स। तीसरी सूरत ये है कि यहाँ पे फ्रैक्चर हो जाए। दिस फ्रैक्चर इज ऑल्सो, ये अगर यहाँ फ्रैक्चर हो जाए तो दिस फ्रैक्चर में ऑल्सो भी ऑल्सो पुश द मैंडिबल फॉरवर्ड्स, एंटीरियर डिस्लोकेशन हो जाती है। बिकॉज फ्रैक्चर तभी होता है इफ यू फॉल ऑन योर चिन और समथिंग, तो फिर उस सूरत में वो जो फोर्स है that breaks the bone also brings the head of the mandible outside the mandibular fossa. Posterior dislocation. Posterior dislocation is very uncommon. इसकी वजह क्या है? इसकी वजह ये है कि ये देख लीजिए, ये पोस्ट क्लिनोइड ट्यूबरकल है यहाँ पे, ठीक है? This is the post clinoid tubercle I was talking about. This plus the lateral ligaments, they prevent posterior dislocation. अब एक इम्पोर्टेंट चीज, वेरी इंपॉर्टेंट, देखो अभी आपको मैंने बताया था कि द जॉइंट इज सप्लाइड बाय ऑरिकुलोटेम्पोरल नर्व व्हिच सप्लाइज आर्टिकुलर fibers to this joint. This auriculotemporal nerve lies on the medial aspect of the um, joint. Yeah. So it is lying on the medial aspect of the joint. On the outside, on the external surface, the joint is covered by the parotid gland. And you know that running through the substance of the parotid gland, you have the facial nerve. Okay? So any surgical procedure, whenever you operate upon the TMJ, you have to be very careful not to damage the auriculotemporal nerve or the facial nerve. Facial nerve का अगर damage होगा तो facial muscles और facial expression के paralysis हो जाएगा. और अगर auriculotemporal nerve damage करेगी, which is supplying auriculotemporal nerve supplies articular fibers. अगर ये nerve damage हो जाएगी, the joint will become lax, loose हो जाएगा. ठीक है? So जब लूज हो जाएगा तो the chances of dislocation of the joint are really high. प्लस अगर कैप्सूल ये जो है और लैटरल लिगामेंट अगर ये भी डैमेज हो जाएंगे या रप्चर हो जाएंगे, तब भी ये जॉइंट जो है दिस बिकम्स अनस्टेबल. तो ये प्लीज याद रखिएगा कि पोस्टीरियर डिस्लोकेशन प्रिवेंट होती है बाय post clinoid tubercle and lateral ligament, ये lateral ligament. और anterior dislocation तो आपको पता है हो ही जाया करती है when this is where it lies. Okay, before I go any further, मैं थोड़ा सा आपको ये introduce कर दूं to the brain. आपको पता है इसके main parts आपको पता है. These are the two cerebral hemispheres. Cerebrum, ये. This is the cerebellum. Sensory relay station, cerebellum. And this is what we call the brainstem. Brainstem from below upwards. The brainstem is medulla. ये pons है, and this part is the midbrain. यहाँ पे देख लीजिए, this is the medulla. ये medulla है, this is the pons. And this part is the midbrain. The superior most is the midbrain. And please note, ye on the surface of the pons, lateral part aspect of the pons, this thick structure, this is the trigeminal nerve emerging from the surface of the pons. ये इसका under surface है, ये cerebral hemisphere है, सारा यहाँ तक. This is the medulla and this is the pons. ये यहाँ तक pons है, and this part is the midbrain, जहाँ से ये nerves निकल रही हैं. And now please note, emerging from the surface of the pons, this is the trigeminal or the fifth cranial nerve. Let's start with the fifth cranial nerve. or the trigeminal nerve. Beta, this is the largest cranial nerve. Okay, body में it is the largest cranial nerve. It emerges from the surface of the bones. अभी हमने ये बात की है. It is a mixed cranial nerve. The trigeminal nerve is a mixed cranial nerve. That means it has a sensory component and a motor component. ये जो thick nerve है, this one, this is the sensory root of trigeminal nerve, and this slender सी nerve, बारीक सी जो ये nerve है, this is the motor component. Together they make up the trigeminal nerve. Excuse me. The trigeminal nerve then enters this trigeminal ganglion. Yeah, the trigeminal ganglion is an entirely sensory structure. ये जो motor nerve है, अभी इस पे आ जाते हैं. This is running with the sensory component. All right, they make up one nerve, but this motor component has nothing to do with the trigeminal ganglion. Okay? This trigeminal ganglion is a flattened structure. This is lying, ganglion is lying in the trigeminal cave. Trigeminal cave जो है, that is a small depression present on the petrous part of the temporal bone. अब ये देख लीजिए, stimuli, sensory stimulation, that is cutaneous part of the face. यहाँ से sensations, they travel back. This makes up the ophthalmic division from the maxilla and surrounding area. From the forehead, sensations from the forehead are carried by the ophthalmic division, which is a sensory nerve. Sensations from the maxilla, the area around the maxilla, ये जो purple है, ये जो sensations है, area, sensations from this area are carried back by the maxillary division. ये green में maxillary division है, ठीक है? And then sensations from this area, the blue one. This is by mandibular division. ये देख लीजिए, ये mandibular division है. Over here. ठीक है? Now, all these three nerves, ये जो है, are all sensory fibers. Cutaneous nerve innervation is sensory sensation. So sensations from these areas carried by ophthalmic, maxillary and mandibular division carried to the trigeminal ganglion. ठीक है? So अब हम इस डायरेक्शन में चल रहे हैं, because जो भी से अगर आपको यहाँ पे पेन हुई है या आपने स्क्रैच करना है, तो यहाँ से इम्पल्सेस जाएंगी टू द ब्रेन और वहां जाके इंटरप्रेट होंगी कि ठीक है, मुझे दर्द हो रही है. सो सेंसरी इनोवेशन इज इन दिस डायरेक्शन. ठीक है? अब ये जो मैंडिबुलर नर्व है ना, मैंने आपको पहले ही बताया था, इसके दो कंपोनेंट्स होते हैं, सेंसरी भी होता है, मोटर भी होता है. सो वी आर टॉकिंग अबाउट द सेंसरी पार्ट ऑफ द मैंडिबुलर नर्व. मोटर रूट की बात कर लेते हैं. मोटर रूट भी ये आपको बताया था ब्रेन स्टेम का, ये मेडुला है, ये पॉन्स है. सो फ्रॉम द सर्फेस ऑफ द पॉन्स मैंने आया था, वो मोटर रूट बारीक सी जो थी वो इमर्ज कर रही थी. मैं आपको फिर दिखा देती हूँ. this thin structure. ठीक है? ये ट्राइजेमिनल गैंग्लियन है, बाय द वे, ये हम पहले भी डिस्कस कर चुके हैं. So from the surface of the pons, the motor root arises, and this passes deep to the trigeminal ganglion. It does not relay in the trigeminal ganglion. It has nothing to do with the trigeminal ganglion, except that the two are traveling together. सो अब ये जो मोटर फाइबर्स हैं, दे जॉइन द मैंडिबुलर नर्व किस लेवल पे? एट द लेवल ऑफ फोरामन ओवेल। फोरामन ओवेल के लेवल पे द मोटर रूट जॉइंस द sensory part of the trigeminal nerve. Up the sensory and the motor. Now they travel together, but कोई इनकी मिक्सिंग नहीं है, कोई उनका फंक्शन में कोई चेंज नहीं है, ठीक है। अब this nerve, trigeminal nerve, this is associated with ganglia, parasympathetic ganglia. बेटा ये जो parasympathetic ganglia है ना, ये 4 parasympathetic ganglia head में, and trigeminal nerve is associated with 2 out of them, otic ganglion and pterygopalatine ganglion. दोनों को इस trigeminal nerve की branches, these ganglia are hanging by the branches of the trigeminal nerve, but functionally इनका आपस में कोई relationship नहीं है, बस anatomically पड़े हुए हैं उनके पास, ठीक है। The trigeminal nerve carries no parasympathetic fibers. Parasympathetic fibers जो होते हैं ना बेटा, वो secretomotor होते हैं, and by secretomotor I mean कि उनकी stimulation से secretions produce होती है, तो motor activity हो गई ना secretomotor। So इसके कोई parasympathetic nerve fibers इसमें नहीं है, because इसमें parasympathetic nucleus नहीं है। ये जो cranial nerves होती है ना, they go and relay or they arise from nuclei in the brain. Nucleus is a collection of nerve cell bodies in the brain, and a ganglion is a collection of cell bodies outside the brain. अच्छा जी, mandibular nerve पे आ जाते हैं। आपको बताया था it has a sensory component, it has a motor component. That means कि it is a mixed cranial nerve. इसमें sensory fibers भी हैं, जिसमें motor fibers भी हैं, ठीक है। Now from the, आपको बताया था कि arises, इसको sensory fibers, it receives sensory fibers from the areas of the face. ये सारा एरिया मैंडिबुलर डिवीजन का है, सप्लाई का। So sensory fibers from the mandibular division go and make up the mandible, and at the foramen ovale they enter into the middle cranial fossa. It receives the motor component at the foramen ovale, and then it becomes a mixed cranial nerve. This nerve emerges, comes out of the middle cranial fossa through the foramen ovale and comes into the infratemporal fossa. ये mandibular nerve है. In the infratemporal fossa, it divides into its branches, which is, this is the auriculotemporal, this is the nerve to the mylohyoid, this is the lingual nerve, ठीक है, this is the buccal nerve, और ये inferior alveolar है जो उन्होंने काट दी है, ये इसका कट एंड है, ये कटी हुई, ये inferior alveolar है। अभी इसको हम देख लेते हैं। प्लस इसका जो मोटर कंपोनेंट है, that supplies the muscles of mastication, posterior anterior belly of digastric, tensor parati, tensor tympani। अभी इसको डिटेल से हम स्टडी कर लेते हैं। One by one, let's do all these nerves. Auriculotemporal. Auriculotemporal nerve जो है, this is the middle meningeal artery है। Middle meningeal artery is a branch of maxillary artery, the first part of the maxillary artery. ये middle meningeal है। ठीक है. So this auricular temporal nerve, इसकी दो roots, it arises from the mandibular nerve by two roots. These two roots, they encircle or they surround the middle laryngeal artery, and then they join together to form this auriculotemporal nerve. अब auriculotemporal उसका नाम बता रहा है कि ये ऑरिकल को भी सप्लाई करती है, ये टेम्पल को भी सप्लाई करती है. ऑरिकल का ये अपर हाफ जो है, ये ऑरिकल उसको सप्लाई करती है. ठीक है जी. अब इसके इस ऑरिकुलर टेम्पोरल के थ्रू पोस्ट गैंग्लियोनिक पैरासिम्पैथेटिक फाइबर्स आते हैं that relay into the aortic ganglion, and they are for the supply of the parotid gland. अभी मैंने आपको कहा था कि इस नर्व में पैरासिम्पैथेटिक फाइबर्स नहीं है. ये बेटा जो पैरासिम्पैथेटिक फाइबर्स है ना, ये फाइबर्स दे कम फ्रॉम ninth cranial nerve, which is glossopharyngeal. ये इस बेचारी ट्राइजेमिनल के साथ तो दे आर जस्ट hitchhiking fibers, इधर उधर से चलते हुए पहुंच गए. That's about all. And don't forget, अभी हमने mention किया कि ये जो auriculotemporal nerve है, this also gives articular branches to the TMJ. ठीक है, since it is passing close to the TMJ, तो ये उसको सप्लाई भी कर रही है. बेटा अगर इस दौरान में if you have any questions or don't understand anything, तो मुझे प्लीज अभी बता दो साथ साथ. अच्छा जी, ट्राइजेमिनल नर्व पे ही चलते हैं. अब इंफीरियर एल्वियोलर पे चल रहे हैं. हम मैंडिबुलर की ब्रांचेस कर रहे हैं. सो द सेकंड ब्रांच इज इंफीरियर एल्वियोलर. ठीक है, दिस इज द इंफीरियर एल्वियोलर. ये वाला अराइजिंग फ्रॉम द, ये मैंडिबुलर है, मैंडिबुलर से इंफीरियर एल्वियोलर अराइज कर रही है. ये दिस इज दिस इंफीरियर एल्वियोलर है ना, this enters into the mandibular canal. ये देखो बेटा, ये mandibular foramen है. यहाँ पे inside, this is inside the mandible, this is the mandibular canal. ठीक है, ये देखो, ये जो strip chip of bone जो cover कर रही है इसको, ये लिंगुला है. इसको sphenomandibular ligament attached होता है. So inferior alveolar nerve जो है, it enters the mandibular foramen and then passes into the mandibular canal. ये देख लीजिए, it is running inside the body of the mandible. Bone के अंदर run कर रही है. ठीक है, और within the bone, within the mandible, it forms a plexus. इसको inferior dental plexus कहते हैं, which is for the supply of these teeth in the mandible. Mandibular teeth को supply कर रहे हैं. Then finally, this inferior alveolar nerve, this comes out of this mental foramen, and now the name changes to mental nerve. So mental nerves is simply a terminal inferior alveolar. अभी जो mental nerve है, ये supply करती है skin of the chin को, mucous membrane, lower lips की mucous membrane को, gingiva को, ठीक है, और आपके दो जो incisor teeth हैं. Now arising from this nerve, mandibular की ही एक branch है, nerve to the mylohyoid. ये बेटा mylohyoid muscle है, which forms the floor of the mouth. इसकी ये, this is the nerve to the mylohyoid. ठीक है, this is one of the branches. Mandibular की अब lingual nerve. Lingual is anything to do with the tongue. Whenever you come across this word lingual, though, it is anything to do with the tongue. Now this lingual nerve, the medial pterygoid and the bone, ये lingual nerve है बेटा, arising from this. It runs between the medial pterygoid and the bone. It runs anteriorly. ये lingual nerve है. It runs anteriorly. This is covered by mucous membrane of the mouth. अब ये जो bone है ना, the sphere है, this is taken from inside of the mouth. That is why you see this. So this is the lingual nerve. ठीक है? This lingual nerve supplies the anterior 2/3 of the tongue. किस lingual nerve? General sensations. पेन में टेम्परेचर का, टच का, you have the sensation of putting something on the mouth, ये एक general sensation है. Plus it supplies the floor of the mouth, it also supplies the gums, the lingual on the inside, gums on the inside. ठीक है, ये आपको सिर्फ, अच्छा इसको यहाँ नहीं, ये सारी जो है ना, दिस इज द लिंगुअल नर्व. ये मैंडिबुलर है, ophthalmic, maxillary and mandibular. Okay, sorry, ये गलत जगह पे आ गया. This is the, now थोड़ा सा मैं बता दूं फिर मैं समझा देती हूँ. Cauda tympani basically is a branch of facial nerve. ये this is, this is the facial nerve, seventh cranial nerve. इस seventh cranial nerve से ये fibers arise करते हैं that make up the cauda tympani. These fibers leave the facial nerve and join the lingual nerve. Lingual supplies the tongue, anterior 2/3 of the tongue. So ये जो fibers cauda tympani की हैं, they are basically fibers contain taste fibers from the anterior 2/3. अब ये sensation है ना बेटा, so जो taste fibers होते हैं from the anterior 2/3 of the tongue, they run in the cauda tympani, which accompanies the lingual nerve. Then it leaves the lingual nerve and comes and joins the facial nerve. So lingual cauda tympani is basically, यहाँ पे देख लीजिए, a branch, इस green को follow करें. This is the seventh cranial nerve, which is the facial nerve. The cauda tympani arises from the facial nerve. Then it leaves the facial nerve, joins the lingual nerve. ठीक है? Now they travel together and supply the tongue. In the meantime, ये जो cauda tympani है, this also supplies secretomotor fibers to these two, sublingual gland and this is the submandibular gland. ठीक है? And then the rest of the fibers, they move forwards and go and supply the tongue. ये देख लीजिए, ये cauda tympani जा रही है, ये lingual आ रही है, running between the middle pterygoid and the mandible, और ये cauda tympani है, that goes and joins this nerve, which is the seventh cranial nerve. Otic ganglion की बात कर लेते हैं. I told you head and neck के there are 4 parasympathetic ganglia. One of them is the otic ganglia. एक बात याद रख लीजिएगा, otic ganglia God has made to provide secretomotor fibers to parotid gland. ठीक है? So ये parasympathetic ganglia है, it is lying in the infratemporal fossa. ये infratemporal fossa है. अब ये भी जो picture है, this is taken from inside the mouth. So this is the medial surface. ये आपको medial pterygoid नजर आ रहा है. So the foramen, ये जो ganglion है, it is lying immediately. This is mandibular nerve. The ganglion is lying in the infratemporal fossa, immediately below the foramen ovale. ये medial pterygoid का posterior margin है. It is lying posterior to the otic ganglion is lying posterior to the medial pterygoid. Also note कि ये mandibular nerve है ना बेटा, it is attached to the medial side of the medial surface of the mandibular nerve, because आपको ये सारा medial surface नजर आ रही है. ये medial pterygoid है, इसमें ये lingual nerve है. ठीक है? Now what happens is कि जो glossopharyngeal nerve, which is the ninth cranial nerve, वहाँ से parasympathetic fibers arise करते हैं. These fibers then travel to the otic ganglion. ठीक है? वहां पे ये रिले करते हैं इंटरकोटिक गैंग्लियन, साइनेप्स करेंगे, रिले करेंगे, फ्रॉम देयर पोस्ट गैंग्लियोनिक फाइबर्स अराइज करते हैं which go and supply the parotid gland. क्या सप्लाई दे रही है? secretomotor. Stimulation of this nerve will make the parotid gland secrete its secretions, reduce secretions. ठीक है बच्चा, अगर कोई क्वेश्चन है तो मुझसे पूछो. Now we come to our last topic, which is the pterygoid venous plexus. हम ये पहले भी डिस्कस कर चुके हैं, तफसील से डिस्कस कर चुके हैं. One quick recap. Location बता देती हूँ. Location is between, it is around the lateral pterygoid. Basically, it is around the lateral pterygoid muscle, between the sandwiched between the temporalis. यहाँ पे ये temporal fossa है, यहाँ पे temporalis होगा. So it is between the temporalis and the lateral pterygoid. It is even, books लिखती हैं, आपकी किताब में नहीं लिखा, लेकिन प्लीज ये देख लो. It is even, part of it is even embedded inside the lateral pterygoid muscle. ये lateral pterygoid है, ठीक है. So as a result, with the contraction of and relaxation of the lateral pterygoid, blood is pumped in and out of this plexus. ठीक है. When the veins in this plexus, when they are full of blood, तो फिर क्या होता है? The mandible drops because of its weight. Yawning start हो जाती है. So it is said कि ये yawning जो है, that's a reflex mechanism for the pterygoid, lateral pterygoid to contract. Lateral pterygoid contract करेगा तो ये जो plexus of veins around the lateral pterygoid and inside the lateral pterygoid, इसकी contraction से the blood is pushed out. अब इसमें बेटा जितनी veins, the veins that accompany the branches of maxillary artery, they make up this plexus. Okay? So all these veins are veins that are running with the branches of maxillary artery. और आपको पता है maxillary artery के तीन parts हैं. One before the lateral pterygoid, one on the surface of the lateral pterygoid, and one beyond the lateral pterygoid in the pterygopalatine fossa. ये तीन parts हैं. Now important thing to remember is कि ये जो pterygoid venous plexus है, इसकी communications हमने उस दिन डिस्कस की थी. There is a deep facial vein which connects the posterior surface of the facial vein to the pterygoid venous plexus. ये pterygoid venous plexus है बेटा, and this was the cavernous sinus. मैंने इसीलिए वो पुरानी ही तस्वीर प्रोजेक्ट की है आपके आगे. And then ये orbit है, ठीक है. This is the eye. This is the superior orbital vein, and over here is the inferior orbital vein. The superior orbital vein at one end connects with the angular vein, and yet the superior orbital vein drains into the cavernous sinus. Okay? The inferior orbital vein also drains into the cavernous sinus, like an inferior orbital vein also gives a branch to the pterygoid venous plexus, communicating branch. Okay? So inferior ophthalmic vein drains into the cavernous sinus, but inferior ophthalmic vein also connects the pterygoid venous plexus. So indirectly, pterygoid venous plexus is connected to the cavernous sinus. Besides that, एक direct communication भी है. ये veins, these veins, the pterygoid venous plexus is directly connected to the cavernous sinus through an emissary foramen, emissary veins के through. ठीक है? So एक direct connection भी है. And the thing to remember, बेटा, extremely important, ये जो pterygoid venous plexus है ना, this then together forms one vein, which is maxillary vein. ये वही maxillary vein है that joins the superficial temporal vein to form the retromandibular vein. यहाँ पे देख लीजिए, ये pterygoid venous plexus है, इससे drain करती है ये मैक्सिलरी वेन। ठीक है, सो ये कॉमन वाइवा क्वेश्चन है कि हम आपसे पूछते हैं, आप बड़े आराम से बताते हो जी रेट्रोमैंडिबुलर कैसे बनी। द superficial temporal and maxillary vein join together to make the retromandibular fine. Maxillary vein कहाँ से आती है बेटा? maxillary vein pterygoid venous plexus से आती है। ठीक है, ये प्लीज आप याद रखिए। ओके, वन लास्ट स्लाइड, ये आपके किताब से ही मैंने ली थी। मैंडिबुलर नर्व का एक सेंसरी कंपोनेंट है, एक मोटर कंपोनेंट है। The sensory component passes through the foramen vein into the inframandibular fossa. इसकी सप्लाई क्या है? सप्लाई करती है जनरल sensations to the tongue, anterior 2/3 of the tongue, plus floor of the mouth, plus inferior oral vestibule को, gums को। ठीक है, मैंडिबुलर टीथ को सप्लाई करती है, लोअर लिप को सप्लाई करती है। उसके अलावा ये आपके बकल पैरोटिड ग्लैंड को थ्रू द ऑरिकुलर टेम्पल सप्लाई करती है, बच्चे को गेनस इनोवेशन देती है। टेम्पोरल रीजन ऑफ द फेस को करती है, एक्सटर्नल लेयर ऑरिकल को करती है थ्रू द ऑरिकुलर टेम्पोरल नर्व प्लस टिम्पैनिक मेम्ब्रेन उसको करती है। Okay, so best of luck for your substage. I'll see you on Tuesday, inshallah.